Imagine this. It's July 2026, and your front desk is fielding a wave of calls from patients who've just lost their insurance coverage. Some are angry, some are confused, and some are simply disappearing from your schedule altogether. At the same time, reimbursements are getting tighter, eligibility verifications more complicated, and your once predictable payer mix is in freefall. Welcome to the new healthcare landscape under the One Big Beautiful Bill Act, a sweeping piece of legislation signed into law on July 4, 2025, with far-reaching implications for nearly every medical practice in the country. Welcome to Medical Money Matters, the podcast where you can find experts, answers, and resources so that you can achieve mastery over the financial and business aspects of your practice. Hello, everyone. I'm your host, Jill Arena. I began my career in accounting and finance, and I have more than 30 years of experience running medical groups. I own and operate a national healthcare consulting and revenue cycle company, and I am the author of Physician Heal Life Financial Self. In 2020, I co-founded the Physician Leadership Project, and my passion is to increase financial and business literacy for physicians. Episode 142. The impact of the One Big Beautiful Bill on private practices. Imagine this. It's July 2026, and your front desk is fielding a wave of calls from patients who've just lost their insurance coverage. Some are angry, some are confused, and some are simply disappearing from your schedule altogether. At the same time, reimbursements are getting tighter, eligibility verifications more complicated, and your once predictable payer mix is in freefall. Welcome to the new healthcare landscape under the One Big Beautiful Bill Act, a sweeping piece of legislation signed into law on July 4, 2025, with far-reaching implications for nearly every medical practice in the country. In today's episode of Medical Money Matters, we're talking about what this bill actually does, how it will affect private practices, and what you, as a medical leader, can do now to position your practice for success. If you lead a practice, run a medical group, or manage financial strategy in healthcare, this episode is essential listening. Let's dive in. First, what is the One Big Beautiful Bill? At its core, it's a comprehensive budget reconciliation act that reshapes Medicaid, reconfigures the Affordable Care Act, and trims various federal subsidies, all under the promise of simplifying the healthcare system and reducing federal spending. But simplicity doesn't mean ease, especially not for private practices. The OBBBA introduces several seismic changes. A new Medicaid cost-sharing model where patients pay $35 per service. Stricter Medicaid eligibility criteria, including work requirements in many states. A rollback of enhanced premium subsidies for marketplace coverage, expected to drop ACA enrollments significantly. Caps on state provider taxes, which will reduce supplemental Medicaid funding in many areas. And while Medicare was largely left alone in this round, it remains vulnerable to future rounds of fiscal tightening. The Congressional Budget Office projects that these changes could increase the number of uninsured Americans by 11 to 12 million by 2034. That's not a distant forecast, it's a tidal shift that will hit private practices hard and soon. Let's talk about timing. Some changes take effect immediately, like reductions in marketplace subsidies. Others, like the Medicaid eligibility cuts and provider tax caps, phase in between 2026 and 2028. What does this mean for your practice? Well, let's start with the big picture. Your patient population is about to change. Many practices, especially those serving Medicaid or ACA patients, will see fewer insured patients and more under or uninsured. Depending on your state, Medicaid enrollment could drop sharply. Practices in expansion states may see more gradual change, while those in non-expansion states could face immediate disruptions. At the same time, patients who remain on Medicaid may be dealing with higher out-of-pocket costs Yes, even the $35 per visit can be a barrier. That could lead to more missed appointments, higher no-show rates, and an uptick in emergency room utilization, all of which affect the overall ecosystem of care. It will definitely add to the stress of your already beleaguered front desk. So, what should you, as a leader, be doing right now? You're listening to Medical Money Matters, a weekly podcast brought to you by Healthy Practices, a healthcare consulting and revenue cycle company dedicated to keeping our clients independent. Please reach out if we can do anything at all to support your practice. You can find more information online at healtheps.com. That's www.healtheps.com. Please follow or subscribe to get all future episodes downloaded as soon as they're released. First, you need to model financial scenarios. Run projections for different versions of the future. One where 5% of your patients lose coverage, another where it's 15%. What does that do to your revenue, your overhead rate, your staffing needs? Next, think about cash flow resilience. Do you have enough buffer to weather reimbursement delays or increases in bad debt? If not, now's the time to strengthen reserves or secure access to working capital. Then look at revenue diversification. Practices that rely solely on insurance reimbursements are most exposed in this new environment. Consider expanding your direct pay services, wellness exams, weight management programs, chronic care programs, retail products, or even simple subscription-based services for uninsured patients. These models don't just generate revenue, they create predictability. Don't forget telehealth. Under OB/BBA, HDHP telehealth safe harbors were preserved, which means you can continue to offer remote care and expect reimbursement. That's a win and an opportunity to maintain access for patients even as in-person coverage wanes. It's also time to tighten your revenue cycle processes. Now, more than ever, eligibility checks need to happen before every visit. It's no longer optional. Billing transparency and follow-up become critical, and staff training around financial conversations with patients becomes more important than ever. Again, your front office will need more support and more training to navigate conversations with patients who aren't accustomed to paying anything at their visits. And here's another angle: patient retention. If your patients are going to be more financially stressed, you want to be the provider they choose to stay with. That means doubling down on communication, convenience, and trust. Help patients understand their options. Offer sliding scale or payment plans where feasible. Partner with community health resources to support continuity of care. Now let's talk about advocacy for a moment. As the OB/BBA rolls out, many of the most critical decisions are happening at the state level. Governors and Medicaid agencies will decide whether to adopt work requirements, how to implement new cost-sharing rules, and how to prioritize provider payments. These are policy decisions, but they have operational impact for you. So, if you're not already involved in your state's medical association or Medicaid advisory groups, now is the time. Practices that show up early in these conversations will be better positioned to shape the rules that affect their viability. We also need to think about partnerships. In this new landscape, isolation is risky. Practices should be looking at collaborative opportunities, whether that's through clinically integrated networks, management service organizations, or direct affiliation with community health centers or rural hospitals. Speaking of rural hospitals, one of the most overlooked parts of the OB/BBA is a $50 billion rural hospital fund. If you're practicing in or near a rural area, that money could indirectly support your services through partnership opportunities, referrals, or shared programs. But again, you need to be proactive and engaged to benefit. So to summarize, here's a strategic checklist to consider. Number 1, run future state revenue models. Prepare for multiple patient coverage scenarios. How would a 10% drop in covered visits impact your financials? Number 2, strengthen your revenue cycle, tighten eligibility verification, patient communication, and collections. It's high time to be getting an A on all of those revenue cycle KPIs. Number 3, expand direct pay offerings. Develop programs that appeal to patients outside the traditional insurance model. Number 4, leverage telehealth strategically. Continue offering virtual visits where appropriate and reimbursable. Number 5, build strategic partnerships with FQHCs, hospitals, or networks that can support financial and operational continuity. Number 6, engage in policy and advocacy. Get involved in state-level decision-making around Medicaid and uninsured care. And finally, number 7, train your team. Focus on adaptability, communication, and financial literacy within your practice. Now that we've outlined the strategies, let's shift to culture. This period of uncertainty will challenge your leadership, not just financially, but emotionally. Staff may be dealing with burnout, financial anxiety, and policy fatigue. Patients may become more demanding or disengaged, and you may feel like you're always reacting. That's where strong internal culture matters most. Be transparent with your team about what's changing and how you're responding. Share the projections, the strategies, and the goals. Involve them in problem solving. The more ownership they feel, the more resilient your practice becomes. And don't forget the leadership principle we often come back to on this show. You get what you tolerate. That's as true in your budget as it is in your break room. If you tolerate inefficiency, avoidable expenses, or unclear communication, it will become the norm. Now is the time to tighten operations, clarify expectations, and reinforce values. Not because things are easy, but because they're really not. Before we close, let's remember this. The One Big Beautiful Bill represents a major policy shift, but it's not the first, and it won't be the last. Practices that stay alert, adaptable, and proactive will not only survive, they'll lead. And practices that wait, hope, or ignore the signs, they'll struggle. So ask yourself, do we understand our risk exposure under OBBBA? Are we taking steps to diversify revenue and improve resilience? Are we advocating for ourselves and our patients in the policy space? If the answer to any of these is not yet, then today is the best day to start. That's all for this episode of Medical Money Matters. If you found this discussion helpful, share it with your colleagues and consider leaving a review. For leaders looking to strengthen their strategic planning and operational readiness, Healthy Practices can support you in navigating these complex transitions with confidence. Thanks for listening, and remember, your leadership is the difference between reacting to change and shaping it. Until next time. Front Office Revenue Cycle Education, an in-depth course on the impact your front desk has on your clinic's bottom line. This online, on-demand 2-hour course is led by seasoned revenue cycle experts who will teach your front office staff the importance of obtaining accurate patient demographic information, how to effectively collect money at the front desk, and their impact on the life cycle of an insurance claim. Available now online for $195 per person at www.healtheps.com under Courses and Force. Enroll your front office staff and watch your denials go away.